Hello, dear colleagues. Hello. My name is Mynzhylky Berdikhojayev and my assistant Ravan Maratlı. We are from Almaty, Kazakhstan. Today is 21st of December 2024. In some places in the world, Christmas and Merry Christmas and Happy New Year. And today we have this patient with the cerebellar AVM. Patient previously bled, and it was a hemorrhagic stroke, and on control MR this AVM was found, and you can see there is a venous hypertension in cerebellum, and first of all is draining to the cortical veins, and after that to the straight sinus, and after straight sinus it's going to the transverse sinuses. From the ICA territory everything is clear. Okay, left side is also clear, no PCOMs. If you noticed, there is no PCOMs. And vertebro-basilar system. Yes, it's very important. The junction of right and left is too high, and we can see separately SCA territory and the ICA territory on the right side, and it's a different compartments from above and below. And let's see the veins. Okay, this is from below. I think there is a junction between ICA territory and the SCA. And one point, patient has a renal failure, and patient on hemodialysis, on chronic hemodialysis, and today, after the procedure, we are planning to do hemodialysis. Yesterday, he had a session of hemodialysis, and today is planned one more session of hemodialysis. There is no pica on the right side. Maybe it's small one. Small pica is here. Okay. Too small. Okay. We'll take sonic from above and sonic from below, and maybe one headway duo from below. Maybe we'll coil it and then inject squid 12. The purpose is to occlude completely from one session. And staged is better, but it was bleed. It was bled. Okay, it's a quite big one. I'm not sure the open surgery is a good option because of the hemodialysis, and patient need to take heparin. Yes, it's a grade 3, grade 4 Schwitzler. Deep venous, size more than 3 centimeter, and okay, it's a posterior fossa. Sonic and sonic. Yes, and it's a general anesthesia. I will take head away. Magic. Sonic 1.2. 2 in SCA and Sonic 1.5 in upper one. Окей. Екі Sonic ташып тастайсаңыз, ташып алатына. И headway ташып тастайсаңыз. Үш ай коннектор жалғайсың? Анау, қойып қойдым, 156. Так, спираль. 6 и оптимальный отделялкасын дайындап қоя салыңыз. Окей. Қалайсың, Нұран? Қалың ғой? Жақсы. Жүріп атқан. Бисмиллахиррахманиррахим деп бастайық. Так, диализ сразу болады ғой, да? Қазір көрейік, егер миы таза болса, диализға барады. Егер КТ-ға байланысты ғой. As we are discussing about hemodialysis, I hope everything at the end will be clear. And if brain clear, then we will send the patient for the hemodialysis because of the heparin. It's a little bit complex to manage. Little bit difficulties in management, but no problem. Екі набор ашып бере салыңыз. Шприц. Так, гибрид 8 бен 7 аралас кетпесін. Окей.
С хвостиком жоқ.
С хвостиком жоқ па? Онда біреу жалғады, жетеді. Андай бар екен ол біреу.
Бере салыңыз.
Соны бере сал, мынаны былай қоясың. Мынау қолданып маған. И екі дымысы ашып бере салыңыз. I am asking for 2 dimethyl sulfoxide. Екі in Kazakh language is 2. The same counting in Turkish language. Тағы бір дымысы. Бір is 1, екі is 2. Same counting. Так, бұл қайсы? Сыртын көрсетіп жіберді. 7. It's a hybrid 7. We have 2 different hybrids. Экранды 10 сантиметр менен тарта салыңызшы артқа қарай. Я. Хорошо. Мендегі мына гибрид не? 007. Сендегі гибрид 08. Тағы да тарта беріңіз. Чуть-чуть. Все, хорошо. И аяққа қарай бір 10 сантиметр тарта салыңыз. Я өзіңізге. Я был. Стол үстіне қойып қойдым. Ешнәрсе ма? Бар сол жақта.
Екі система жетеді.
Жетеді. Пока бір система жетеді. Так. We are preparing Sonic 1.5 with the hybrid 8. It's coming in the box, and the second Sonic is 1.2 by 35. Both are long Sonics. Yes. Yes, at the end of the year, the insurance system gave some quotation, and we can do cases. It's good because patients are waiting for the treatment, and it's very important for patients. Так, мына бетес мынаған жалғайсың, суын шығарып. Қазір қайда тұрсың?
Қазір БЦА-да справа тұр.
БЦА справа, да? Былай емес. Керісінше. Орындарын ауыстырасың. The angulation of the Y connector on bulb Y connectors is less than 45 degree. It's nearly 30 degree. And the angulation on other Y connectors is a little bit more. That's why we put two bulb Y connector and one, I think it's a merit Y connector. Okay. I'll take this to fix my guiding. Так, ну Бerdikhojayev, да? Okay. 1.5 we will place in Айка пайка. It's Айка пайка. Қандай дефицит бар?
Дефициттен правосторонний инверс легкий.
Okay. The patient has 4 degree hemiparesis on left side and visual symptoms. Так, екіншісі.
Екіншісі не так?
Суға салсын. Пока суға салып қойсын. Patient has visual symptoms and left side hemiparesis and cognitive impairment. Maybe because of renal failure, maybe after stroke. It's all the time mixed factor, complex factor. Okay. Мынаны кигізесіз. Алдымен мынаны кіріп алайық. Сосын анамен үстіңгі тамырға кіреміз. Так, назад, проводник. Окей. Так, just a second. Опс. Біреу звондап қалды ғой. Қайтадан басына қоя салшы. Окей. Ташпулатный экран тағы бір 10 сантиметр тартса болады. Аяққа қарай. Аяғына қарай. Тарта беріңіз. Өзіңізге қарай. Өзіңізге. Отлично. Рахмет. Tamam. Yes, we will go through the vertebral artery for vertebral basilar system. This is vertebral. Yes, it's a vertebral artery. It's a V3 segment. Decrease the radiation. Until now we have no the touchscreen module. That's why somebody should help in the control room all the time. Yes, that's it. Management problem. Okay, something like this. Хвостик бітіп қалды ғой, да, ташпауытын? Ой, коннектор. Талғат қайту керек, ауыстырып бере сонда. 20 шақтысын. Ташпауытына ішіне 8 мг нематоп қосып қоясыңызшы, промывка. Осылай қойсын. Стоп. Ішіне 8 мг нематоп қосыңыз. Okay, this one is less complex, that's why we will use this one. Because of two-genu angulation, it could be a little bit complex, that's why we choose this one. We do it especially to prevent the leaking, water leaking. Okay, but SC navigation could be a little bit problematic because of angulation. Yeah? Okay, let's see. This angle is less problematic. Okay, at this point. It's like a small branch. Small branch. Okay, let's do the angio from here. Растет. Да. Так, и Y коннектор, да. Казр. Пока брумет ротор, пока. Хедвейн еще салсаш. Yes, it looks like there is a small branch. Goes up and then down. Okay. No, сейчас also. Okay. We will place in parallel. How do I do? Yes, sure. I asked to put 8 mg nimodipine in the system because of the multiple access, it might cause some spasm. And through the, it's a 7 French Fubuki, through the 7 French short introducer sheets. Fubuki 7 French with the angulation, angled one. The same angle. Now is better. It's going to the bezel. Okay, it looks like there is some step. Okay, there is angulation. It's placed. Okay, now it's going. Хорошо. Şimdi iğnesi gidiyoruz. Yes, now it's clear. It's an AVM and it's a lateral part of the cerebellum. I think this point is for coiling. Okay. Yes, it's might be for coiling. Contrast fluorescence też плотно. Yes, because of dialysis, we are not scared from contrast, but it's not so much. Basına kança kontrast oldu? Arı? Kança kontrastın basın?
Basında mı?
Yeah.
Kadın полный день.
Düz oydu.
Yeah.
Okay, we started with the. It's still first bottle of 100 cc of contrast. Not so much. Okay. Но инесін кегізіп қоя сал, бұл 8 болады. Так, яна екіншісін 7 ішіне қоя бер. Гибрид 7 ішіне сала бер. Таш болады ма? Yes. This looks like too close, huh? Let's check with this. Okay. Maybe better to pull it a little bit. Ташпортна бір жарымда 4 деген спираль ашып бересіңізші?
Хеликал ма?
Хеликал, я. Біреу комплекс. И отделялся наш пересылся.
Новые наши.
Я, пожалуйста. This is 1.5 by 4 Optima coil. Okay. Это жасловый, да, комплексовый?
Комплекс.
Это комплексовый. Видите же? It's a detachment system. Так, та біреу наш пересылся, ташпортна. Бір жарым 4 та біреу наш сонсы. It was helical, yeah. Okay, the first one is helical, and the second one I am asking. It went to the. Ne yapmışlar? Tartıyor. İkincisi varsa. Evet. This is the second coil. There's the same. The first was helical, and now it's a complex one. Ташпортна та біреу вынесіңіз. Я осында. Все, бери беріңіз, бір жарым тұр. It's a so-called pressure cooker technique, but with bit modification without NBCA. NBCA is histacryl or glue, and in Kazakhstan NBCA and Lipiadol is not available. That's why we modify it and just need to wait for 5-10 minutes, and then it's creating very stable plug and no need for glue injection. It's our small modification. Because of the electrically detachable coil system, it's very thrombogenic comparing with the mechanical systems, the thrombosis is quite faster. It is water thrombosis. Okay, let's check with this. Okay, this will leave for control. And let's check with this. Yes, the venous side is now quite slow. And now we will take a sonic. Где-то? Новый, да? Okay, we'll take hybrid 7 with Sonic 1.2. I hope the navigation will be not so complicated because of the angulation of the superior cerebral artery. Yes, we are humans, and human factor is also here all the time. We say we hope, we pray, and I hope everything will be okay. And patient also the human. That's why it's important, human factor. Назад? Так, оно там что трудно. Yes, it's a nice system with Fubuki 7. It's possible to place 3 microcatheters thanks to hybrid 7 headway duo. It's the same 10 system like Echelon or headway 17, and through this Fubuki 7 it's possible to place 2 balloons or 2 sonic. It's nice, very nice system. Yes, the navigation will be a little bit like this. Yes. I think it's our branch going to the AVM. There are bifurcation, but we'll place it as distal as possible. Yes, with this branch. Okay, maybe we'll use this one. Just a second. Okay, there is one more angulation. Okay, there is an angulation. Like this. Maybe it's enough, huh? Just a second. On image AP, it looks like there is some space. And I will take this. It's a 3cc syringe in Sonic 1.2. Okay, that's also coming to the AVM. Maybe a little bit proximal. There is another branch. Okay, now it's better. This location is better. Yes, small territory. Just a second. Must look like the same way, huh? So, no, so. We'll take out the road map. Now we can see the screen above, and let's place it on the screen above. 1, 2, and now we can see the territory of the smaller one. I hope we can cover both territories. Okay. And let's check the pica. There is also pica from below. Yes. Small branches coming from below. Stop. It's coming from below, and it's better to fill this collateral from outside to inside. Maybe it's connecting. Okay. Okay, I hope there is a connection. Okay, let's start with this, and then we will complete with this. Or better to start with upper one, huh? Жоғарғысы дұрыс па?
Жоғарғысынан ба?
Just a second. Let's put it here. And now. Okay. Maybe we need to start with upper one, huh? Так, сквитывание кверсал, стаж плотно. Инженер. Пока брюжи сал жетет. Азырше. Okay, let's start with upper one. And let's check the coil thrombosis. It's very important. Oh, it's still filling. Then we have time for thrombosis. Okay, that's good. Now I will speak in Kazakh. Ассалаумағалейкум, қалдарыңыз қалай? Сәлеметсіздер ме? Баршаңызға сәлем бердік. Европада тұратын қазақтарға Крисмас құтты болсын дейміз. Наркоз поглубже, дексаметазон. Наркоз, дексаметазон. 12 миллиграмм. 12 milligram of dexamethasone, and we asked for a little bit deeper narcosis, and I will not increase the radiation. Let's see. Глюға қоясың, что ж плотно. Yes, at the time of start of injection, it's better to ask for additional anesthesia because it's a painful procedure and needs some narcosis. Шай рахмет. Шай ахмет қой деймін, да? Шай ахмет, сәлем. Алейкум ассалам. I mixed the sonic and now I am injecting from the middle one. It's a human factor, no problem. Отлично. It's inside the vein, no problem. Okay, let's wait a little bit. A small branch. This branch is going. Stop. Надо шагать. Назад. Артка. Yes, now we can clearly see this branch, which is going to the AVM also. Yeah, надо шагать. Назад. It's a little bit proximal. Okay. Okay, that's good. Now we have full control. Okay. Нені бересіз? Тағы да бір сквиттен бер. 12. It's a reflux. I will bring my headway a little bit back. And we can control territory. Oh, it's a bifurcation. It's refluxing and it's also going forward. That's why we continue to inject the squid 12. It's okay. Now it's AVM territory. Екі территория қосылуы дейм. It looks like we covered both territories. The upper one also. Так, сразу Дженевер. Уник Дженевер. This is a branch coming from below. Yes, now it's occluded. It's very good. This is still there. Now it will start to fill the vein. Somewhere here, it's a draining vein. Okay, let's check this. It's good. Then we don't need to go to that territory. It's occluded. And now I will take another one squid. We'll start to inject from above. Very simple. Yes, the Fabian from Stockholm calling this technique the Kazakh eagle grip technique. He has very good imagination, and I didn't ask him, but I think he has hobby of painting or something like this. He's a very good friend of mine, and I hope Fabian is looking for this operation. Hello Fabian, how are you? This is upper one, this is lower one. Now I will continue with lower one, which is close to the, yes, and it's a little bit reflux, so we couldn't see it, but reflux is there, and it should be very careful injection. Reflux is what. This is AVM. This is arterial part. It's very good. Now it's look like it's a venous part. It's arterial and venous part. Okay. Так, наш шприц хата да несеш? It's first microcatheter. I asked for one to fill with little bit squid, and distance between the second marker and the first marker of the upper sonic is quite distal. That's why we don't need to go backward so much. I think it's enough. Okay. Okay, sorry. It's the same microcatheter. Marmaro. There's one. Okay, it's a syringe number 3, yeah? It's a lower sonic. And it starts filling the venous part. It's good. I think this all is venous part with the arriving arteries. Oh, vein, venous. This look like vein. Okay. This one is upper one. Okay, let's inject a little bit from upper one and then we can do control angio. This is upper one. And as the reflux is enough. Upper one, lower one. Okay. Super selective control. No problem. And common injection. There is no more AVM. But we need to continue a little bit to fill all compartments of the AVM with the draining veins. That's okay. Okay. Так, no. It's upper one, it's lower one. Upper one, lower one. Let's inject a little bit with upper. It's a reflux. And now injection with lower one. Yes, it mostly goes to the venous compartments and yes, when you reach the venous part, it's a high chance to occlude retrogradely. It's also very important. Okay, we injected both. Now we have a little bit time. Okay, let's check the venous part. Okay, there is 1,000,000 veins going from upper part, middle part, and lower part. Like we still at the territory of the AVM. We didn't go outside. That's good. Okay, and thanks to Alberto. Alberto said it's enough to do only one magnification on low dose. And today is possible because it's a first session. Yes, it's upper branch, and now we can go with the lower branch. Lower branch is all the time going to the draining veins. Okay, it was something like this. Unfortunately, we couldn't play with the upper part. Okay. Fortunately or unfortunately, we couldn't play with the upper reference image, but it's okay. It's okay, no problem. I think with head-weighted duo, we need to go to the upper branch and check the proximal part of the branch. With the lower, it's gone. It's done. Так, ну хайса. No, this mark, no? Okay, let's take it. Kutnik liежишь. Yes, it's an advantage of working in a multidisciplinary hospital or multifunctional hospital, where you have a hemodialysis and every other stuff to help the complex patients. The same in Astana. Yes, it's a multidisciplinary hospital in Astana also. Okay, let's leave it like this. That's a time. I will first inject from upper one. This is upper one. It's a reflux. I think I need to do a little bit more reflux. And now I covered all territory of the AVM. It was a small branch coming to the AVM and now it's clear. Okay, it looks like the pressure in lower compartment it's quite high and maybe it's time to stop. Okay. It's going to the venous part. This will change for this is lower one. And this I will prepare to take it out. Okay. It's a squid syringe and when you do a little bit pressure, like this, then it's locked. We need a little bit more time for the SC microcatheter, and I will do with control. We will do control and let's check. Yes, now it's all stopped. Yes, there is no flow. Екінші системаны берсең. Ауыстырасың. Pardon? Okay. Change. Анан жабасың. Вот. И арғысын бері айналдырып қоясың. Now we will continue with the Ika branch through the Sonic 1.535 and we are filling the draining veins. It's an important part of the treatment. Okay, I think it's a draining vein. It's in parallel with the upper branch. This one, I think. Yes, it looks like this draining vein. Okay. Just a second. Now we can take out the headway. It was very helpful. The role of the headway is very important in this treatment. Now I will try to pull my Sonic 1.2. I just give it tension. I think it's not enough time, but let's leave it like this. Okay. Yes, it's a draining vein. It's all inside the AVM and draining veins. Okay, I think it's a draining vein, and at this point I think we can stop. Huh? We can stop. Okay, I will release a little bit upper sonic. Okay, that's the control, and everything, if everything is okay, then we'll take the micro catheters out. Okay. Let's, okay, everything looks clear. It's a bit stagnation. Okay. It detached between the second and third markers. Okay. No problem there. Okay. Take out my there's the photo case here. Let's take it out. Yes, we need a little bit time. And usually 25 minutes enough to take out the sonic. It's a maximum tension, huh? Not so tension. Okay, let's wait. Let's wait. Let's wait a little bit. Ну-ка, назад, вперед. Вот. It looks like the sonic is not detached. That's a so-called hijama. What's up, I will do a little bit aspiration. It's to prevent the embolism. It's very important. Okay, now suppressing. I hope the brain is clear and no need for any action. Okay. Yes, it's arterial stagnation. Okay, let's do control CT and then we can decide. Okay, let's wait for control CT.
Резидент Бержидер ма?
Жіберіп қойдым ғой сізге почтаға.
Почта.
Почтада көп документтер почтада жатыр.
Резюме көрген жоқпын да сіз.
Резюме де почтада. Okay, the CT is ready. Let's see. The buff is okay. The brain is here. There is no big hydrocephalus. This is a brain, and there is no. It looks like no bleeding. Okay, now it looks better. Let's see it like this. It's also clear. And let's look like this. Okay. I need to check the last angio. Okay, for the any kind of emboli. Oh, everything is here. Okay, we can finish the case. Everything is clear. Now we can stop the operation and see you in 30 minutes. Next patient. Aneurysm minigam. Yes, next case is aneurysm. We have 8 aneurysm and 1 meningioma. Let's see, today and tomorrow we will try to finish these cases. See you in 30 minutes. Thank you for watching. See you.